What's up, guys? Dr. Chris here, and today I want to talk to you about how to manage a condition. So, whether you have an orthopedic condition or a friend or a family member has one, you can use this easy mnemonic to remember how exactly to manage a condition. So, here it is. It's a little bit goofy, but bear with me here. It's Pam takes her car and goes to AA. So, let me break this down for you. If you're having pain, whether it's knee pain, back pain, neck pain, whatever, what you want to do is positions, activities, and movements that centralize the pain, abolish it, or reduce the pain. That's the Pam and the car part of this mnemonic. So let's go over centralization. Centralizing pain means it goes from kind of big and widespread to small and less intense. If you're having pain that is widespread in the shoulder, it needs to become more centralized or localized. In the back, you can get back pain across your back or into the glute, down into your leg, and we want it to centralize or become more local. That's a positive thing. Now, if your pain abolishes, that means it completely goes away, and that's a really good thing as well. And then, of course, the R is reduction. And yes, if you can find a position, activity, or movement, or exercise for that matter, that decreases your pain, that is a good thing. Now, the next part of the the mnemonic, is AA. So what you want to avoid is positions, activities, and movements that are causing your pain. You want to avoid them or alter them. So a really easy example of this is if I'm having knee pain, I'm going to take you through the car part and the AA part. So let's say I had this knee pain. It's in my right knee and it is really giving me a problem. It's in the front of my knee. It's like this constant ache. So the first thing that I need to do is find positions, activities, and movements that centralize the knee pain, get rid of it, or decrease it or reduce it. Now, some of those things could be, I can use ice, I can rest it, I can do some gentle stretching or movement if that helps it, if that gives you the car part. What I want to alter or avoid are the things that make it worse, right? It seems like common sense here. And it is, but we need a good framework. So for example, in that right knee pain, if it hurts to sit in this particular chair, or it really hurts me to kneel down, then I need to alter and or avoid doing those things temporarily until I heal. I need to focus on the cars, right? The things that centralize, abolish, or reduce the knee pain. And then I can gently add in the other things that were making it worse before. Like I can try to sit in that chair again. I can try to kneel on it. But remember the framework. It's Pam takes her car and goes to AA. Positions, activities, and movements that centralize, abolish, or reduce. Or on the flip side, I need to alter or avoid those positions, activities, and movements. Another really easy example is back pain. So I see a ton of back pain. I see a lot of pain for that matter. There's a lot of patients that are we live in a world of hurt. So we need to learn how to manage conditions. So if I have a patient that has back pain, I'll work with them to try to manage this. So we go over, again, those positions, activities, movements, and exercises that help to centralize, abolish, or reduce the pain, and then we alter or avoid the activities, positions, and movements that make them worse. So here's an example. The other day, I was talking to a patient, and this patient had writhing pain, just so much pain in their back, and they were really upset about it. And we talked about the things that made them worse. So we're gonna go through the AA right now, the things that he needed to alter and avoid. He was sitting in his recliner. Prolonged sitting made him worse. And kneeling down, like he was kind of doing some house projects, that made him worse. Activities that made him better or centralized, abolished, reduced, or walking and just doing general exercise. Actually, running also made him better. I remember him telling me that. So it was a little bit of a different case, right? Because you'd think, he kept saying to me, well, is running making me worse? Well, no, it was making him better. It was a car. It was in that bucket. So I just encouraged him that no, he needs to alter and avoid doing the prolonged sitting and the bending, and he needs to continue with the running, the exercise, and the walking, because that was making him better. The number one question that I get asked all the time is, what should I do and what should I not do? And they follow that with, can I do chiropractic? Can I do acupuncture? Can I go get a massage? Should I do those things is what they also say. They say, can I and should I? They want so much guidance. So I'm here to tell you that with this mnemonic, it's really easy to fit things in buckets. So for example, I get this a lot. Hey, my back is hurting. Should I go to the chiropractor? Should I do acupuncture? Should I do massage? So my quick answer is, yes, you can. You can do those if they don't make you worse, right? If they make you better or the same, go ahead, you can do that, right? Because that fits into the car bucket. If it centralizes your pain, abolishes it, or reduces it, you can absolutely do it. The next question that I'll have is, what's the cost benefit analysis on that? Do you have the time, money, and desire to do massage, acupuncture, chiropractic? Because if you do, then you can absolutely try those things. Now, are they the most cost effective? Are they the thing that's gonna really push you along to go from 0%, like my condition's terrible, to 100%, I'm all sorted out and I feel great? Probably not. Most people need an active approach. They need to actually work on positions, activities, movements, and exercise. They need to take that active approach. They need to own their condition, and then they can get better. But going back to it, if they want to do laser therapy, shockwave therapy, anything, chiropractic, acupuncture, massage, all of those things are fair game as long as they fall into the bucket. Arasti's another one. But remember, those are all treatment approaches. Treatments are not bad, but they're different than management. So management is when you work on your own condition. You're learning how to manage it through the positions, activities, exercise, lifestyle change, all that good stuff. Treatment is when someone does something to you. Again, it's not bad. It just needs to fall into that car bucket. It has to centralize, abolish, or reduce your pain. I hope this video helps you or someone you know that is suffering with pain.